A three-way Foley catheter is a specialized urinary catheter designed for use in situations where continuous bladder drainage, irrigation, or medication delivery is needed. It's commonly used in hospitals and clinical settings for patients who need a catheter for a longer duration. Let's start with the first part, the catheter tip. This is the rounded end of the catheter that gets inserted into the bladder. Notice that there are usually multiple drainage eyes. These small holes at the tip allow urine to drain efficiently once the catheter is in place. The drainage eyes are crucial because they help prevent blockages and ensure smooth drainage of urine from the bladder. Next, we have the balloon. This part is located just above the catheter tip. Once the catheter is inserted, the balloon is inflated with sterile water to keep the catheter securely in place inside the bladder. The balloon prevents the catheter from slipping out. This balloon ensures that the catheter stays put and doesn't move around, which helps reduce discomfort and complications. Here we have the catheter shaft, the flexible tube that connects the balloon to the drainage and irrigation ports. This is the part that stays inside the bladder and allows for urine to flow out into the drainage bag. The shaft is designed to be flexible, which makes it easier to insert and more comfortable for the patient. Now, let's talk about the drainage port. This is where the urine flows out of the catheter and into the collection bag. The drainage port is usually at the end of the catheter shaft. The drainage port is essential for continuous urine collection, ensuring that the bladder remains empty and preventing any complications from urinary retention. Here's what makes the three-way Foley catheter unique: the irrigation port. This extra port allows healthcare providers to irrigate the bladder, flushing it out with a sterile solution to remove any clots or debris, or even to deliver medication directly into the bladder. The irrigation port helps keep the catheter clear and ensures the bladder remains free from blockages or infections. At the end of the catheter, we have the connector or adapter. This part connects the catheter to the drainage bag and the irrigation system. It's where the syringe is attached to inflate the balloon and also where you connect the irrigation line. The connector is an important feature because it allows for easy and secure attachment of the catheter to the necessary systems. So, to recap, here are the parts of a three-way Foley catheter. Catheter tip with drainage eyes, balloon, which keeps the catheter in place, catheter shaft, the flexible tube for drainage, drainage port for urine collection, irrigation port for flushing and medication, connector for attaching to the drainage bag and irrigation system. Understanding these parts is essential, especially if you're working in healthcare or studying medical devices. A three-way Foley catheter is a versatile tool that helps manage urinary retention, irrigate the bladder, and provide direct medication delivery, all in one device. Thank you for watching. If you found this video helpful, make sure to give it a thumbs up